Why is it so important that patients with inherited retinal diseases get referred to a specialist?
Inherited retinal diseases are complex disorders. They are not so straightforward as other diseases, so they require a specialized evaluation. And when I'm talking about that, I mean, for example, electrophysiology. Those tests are usually done at academic centers. They require a lot of preparation. They are time-consuming and give us a higher level of understanding of these inherited retinal diseases. Part of the evaluation also includes specialized imaging, specialized functional testing, such as microperimetry, such as Goldman visual fields, such as perimetry done in the dark. So all these specialized testings can only be done in places that are devoted to see these patients. And in addition to that is the crucial component of genetic diagnosis. Genetic testing, it's more complex. The interpretation for the physician requires to spend a lot of time analyzing the variants that are presented. It requires an understanding and a matching of the results with the phenotype that we have observed with this specialized testing. So all those things are usually best done in places devoted to the care of these patients.
What are some of the warning signs or symptoms in an infant?
Infants can present with nystagmus, and as we all know as physicians, that is the involuntary shaking of the eyes, most commonly in a horizontal way, but it can be vertical as well. That nystagmus is a warning sign of an inherited retinal disease or also any other type of eye disease. Also, a white pupil, it's a concerning sign. A kid that is not having a social smile, a kid that is not able to fixate, or that it's tripping and falling, or that it's afraid of the dark. All those warning signs, including when the patient is squinting or it's photophobic, all those warning signs are could be an indication of an inherited retinal disease. And thus, it's very important that the optometrist refers to a pediatric ophthalmologist or a retina specialist, and they work as a team with an inherited retinal disease specialist with the aim to provide, again, early diagnosis, because the earlier we achieve a diagnosis, the more opportunities this patient is going to have of benefiting from a clinical trial or a therapy before the cells are lost.
How can somebody find a specialist?
A good resource is the Foundation for Fighting Blindness website. It has a specific section of Find a Retina Specialist. So in this area, physicians and patients can find specialists that are very familiar with inherited retinal diseases.
Well, thank you so much for your time today. This was really informative.